And welcome back. Thank you for choosing African Perspective this evening. So as promised, that panel discussion hosted by the SABC as well as CGTN, that is the Chinese Global TV Network. We're going to be looking into the rollout programs in relation to the vaccines that are currently on the market, also looking at some of the research that has been done, including the mutation of the COVID-19 vaccine, rather the COVID-19 virus. Also, this conversation is being held in collaboration with the WHO, Africa CDC, as well as the China CDC. And our very own Sophie Mokoena, our foreign editor, is leading that conversation. Take a listen.
Hello and welcome to Dialogue with the World. I'm Zhou Yue. As new COVID-19 variants emerge, the WHO says some in Africa appear to be more infectious and are fueling the continent's second wave. China and Africa have enjoyed a close relationship for decades, so how can the two sides work together to combat the pandemic? Helping me discuss these issues in today's special broadcast is my co-host, Sophie Mokoena, foreign editor at the South African Broadcasting Corporation. Sophie.
The developing countries are still struggling, particularly the African continent. However, this week we saw Ghana becoming the first recipient of the COVID-facilitated vaccine. Equitable distribution is a huge challenge. So how can it be addressed? Joining us are Dr. Nikaes Ndembi, Senior Science Advisor and Head of Africa's CDC. Vaccine effort, as well as Dr. Fiona Atuhebe, new vaccine officer at WHO in the Sub-Sahara region.
And from China, we'll be joined by Dr. Gao Fu, Director General of the China CDC, and Wu Zhiwei, Professor and Director of the Center of Public Health Research at Nanjing University's Medical School. Maybe let me start with you, Dr. Gao. When did you hear the first emergence of a variant?
Well, I heard this by the end of last year. You know, the initial variant we observed is the variant arriving in the UK. We call it variant 1. Of course, the variant we found in South Africa, we call it variant 2. By now, we have more than a dozen of the variants already there. So everybody is worried, including me, because of these variants. The mutations are located in the spike protein. That protein is very important because it's the target for the vaccine under development or the vaccine under use. So, however, from the current data, we see some vaccines are still working, even for the variant in South Africa. So two of them is developed by China. One is an inactivated vaccine. The other one is a recombinant protein vaccine. It looks like it's still working. So we are worried, but from the current data, we believe that we still have some effectiveness or efficacy from the current vaccine under development. Thank you, Zhou Yue.
And Dr. Ndembi, it seems that African countries have recorded some of the lowest numbers of COVID cases, and people say one of the reasons is the testing is still running low. Are there concerns that there could be a gap between the real picture and the recorded cases in Africa?
Yeah, thanks so much for inviting us as Africa CDC to this panel. Yes, I think it's quite complex to be able to draw such a conclusion. But data that we're actually generating from serosurveillance probably provide more in-depth information on the level of exposure. So I think as far as we are concerned in terms of testing, I think we're doing quite good in terms of test per ratio that have been set by the WHO. Thanks, and over to you.
And Fiona, obviously this virus is still mutating as expected, but how worried should the world be about the mutation of COVID-19? And how long do you think before a variant emerges that is totally immune to the current vaccines?
Thank you, Zhu. This is, you're asking me a prophetic question, how long would this be? Well, we expected the variants because viruses generally tend to mutate. They actually end up mutating. We also anticipated that the coronavirus would mutate like any other virus, but we did not anticipate that it would come with the impact it has come with, and that it would also spread at a rate that we are seeing it spread. So we are quite worried about it. We know that one of the strongest tools we're looking forward to, which is the vaccine, some variants have shown the vaccine has some reduced efficacy on those particular variants, and we are quite concerned about this. How long will this last? We do not know, but we are carrying out a number of studies, and we are also requesting the world to urgently launch studies as much as possible to see how far we can go with trying to contain the mutations that have already started.
I just want to pose a question to Dr. Gao Fu. Doctor, I just want to find out, in terms of your experience in China, have you detected any types of variants in your own country, either imported or perhaps detecting it internally in that country?
We are worried about that mutation would have some side effect for your vaccination. So in China, we saw some mutations even from the very beginning. You see the evolution of the virus. However, we haven't seen any really, critical mutations for the vaccine target, i.e., in the spike protein. Because in China, in Wuhan, that's the place we initially found the virus, but quickly, because of containment measure, it's gone. Last April 8th, we have the last, viruses there. But we also have some variants like we call it V1 or V2, but they are all from imported cases, detected in imported cases. We don't have any local, i.e., China's mutation like the one you have in South Africa, Japan, Brazil, or the UK. So, conclusion, in China, we have some variants. We don't have the variants arising in China during this sporadic outbreak caused by the imported cases for the last year. Thank you.
Dr. Ndembi, let's come back to the continent. How many countries have reported variants? And also in terms of what we are doing to keep up with science to address this issue. Are we doing enough? Is CDC Africa doing enough in partnership with scientists on the continent and around the world to really study the mutation of virus?
Yeah, I think I will join the panelists to just confirm that virus mutations or the generation, the virus evolution is a continuous process. And then just for your kind of analogy, if I just get one single example in terms of RNA virus, like HIV, there are over 100 different variants or strains of HIV, for example. Because every single day, there are new mutations or new strains that are going to be generated as part of the survival process that Professor George did mention. So what we're doing now currently is really to encourage member states to embark into genomic surveillance so as to be able to track the evolution of the virus and also detect some of these mutants that could actually have an impact on not just the vaccines, but therapeutics as well as diagnostics. Very important, because those are the first steps before we get even to the vaccines. So what we do at Africa CDC, really we are strengthening capacity for genomic surveillance across the continent, and also among those reference centers of excellence that we've established in the 5 regions. I think that's an effort that we've been supporting in collaboration with partners like WHO, and also strengthening capacity building for member states.
Can you tell us, is there any features about the geographical distributions of those variants? It happened in United Kingdom, it happened in South Africa and Brazil. Why some are more virulent and why some are not?
Well, actually, the viral mutation, it's a complex process. Basically, it has a lot to do with how the virus transmitted and in what kind of environment, and also it also has a lot to do with the population itself as well. So basically, the mutation is driven by the environment where the virus replicates. So if you look at the first viral mutant which arrived in the UK, which is quite different from the mutant arising from in the African continent. So if you look at the Brazilian mutant variant, also is quite different. And also one thing we need to bear in mind is that those different variants are not as we call it, single point mutations, only in the spike region, as Dr. Gao just mentioned. But there are a lot of other sites get mutation as well. So basically what you can see is that those different mutations, they combined, they contribute to the virus replication capacity and ability, and also in the way they cause the disease. And although, we don't really have very detailed scientific information on those variants, those combinations may also contribute to their resistance to the vaccines as well. So what I would say is that, you can't simply dissect and build up a geographic distribution of why this particular variants appear in certain continent. So this is a complex issue which we actually have to wait for further scientific research. But we do see right now is that the three major variants actually they seem to be, they're all having improved the infectiousness, and also in the ways that they do cause certain resistance to the vaccines.
I have a question to Dr. Atuebe. Doctor, in terms of what we have done on the continent in trying to manage this impact of the new variant, particularly in South Africa, have we learned certain lessons to ensure that in future we are able to look ahead?
So yes, a lot of lessons have been drawn from this, especially the fact that the variant first discovered in South Africa went straight at the point when we were planning to roll out the vaccine, when South Africa had already even imported the AstraZeneca vaccine. And then suddenly we see the change that we saw, that the AstraZeneca vaccine was not as the efficacy was not as strong as we expected on this variant. So this has also taught us to prepare very well and anticipate some of these things. We anticipated that the variations will happen, but we did not put in place mechanisms to see if this happens, what shall we do? And we were caught by surprise, more or less, when the vaccine was ready in country. But I must say that with the disease being very new to all of us, and the variants also being very new, we did not know what the virus will mutate into, or what will happen to the spike protein, or which part of the virus will actually mutate. But now we are very lucky to see that there are some vaccines that are still strongly working on these the variant types. And one of the lessons we've learned is to keep the science going, and the global solidarity that we've been calling for. Once it is identified in the UK, then the scientists are going on and continuously accumulating this data and evidence, and all the work that we are doing following science and data.
Yeah, I would like to add some point there to what Dr. Fiona just mentioned. As part of this is really a kind of a continental response as well, because this is a case where South Africa proactively were monitoring using their genomic surveillance approach, and we're able now to detect the V2 variant, and subsequently implementation science data supported using clinical data research and with pseudovirus assays to demonstrate that a wide range of some of these vaccines could be efficacy could be affected. I think as part of that response, Africa CDC, through the Consortium for COVID Vaccine Clinical Trials on the continent, is now having kind of national history court, whereby we can have a repository of samples and being able in the long term test the efficacy of some of these vaccines that will be rolled out on the continent. So we are proactively working with partners as part of this response, having a continental response to a problem that we actually have in common. Thanks, and over.
I want to talk about vaccination, Dr. Nembi. Do you agree there is a global competition over access to vaccines? And how would you say the African countries are sourcing their vaccines at the moment?
Yeah, I think it's again a very complex question there, but what we do believe that is an unprecedented situation where we will have to vaccinate the entire globe, at least for some at least countries will embark into a vaccination campaign. I think this is unprecedented. I think we haven't seen that maybe for the past 50 years where we have to go through this challenging process. So it definitely calls for competitions for the market, getting access to some of these vaccines. So, however, I think Africa has at least 4 sources for now. The COVAX facility that we all have referred to already in this discussion. So, and then the African Vaccine Acquisition Tax Team from the African Union. And we also have support sources from donors that are contributing for this effort, and also funding support from multilateral institutions. I think that's for now what we can provide as outcome, and some bilateral deals as well. So we are aware of that and multilateral.